This video about muscle growth for lifespan extension. So this I describe here a way to rejuvenate my body. So this is a long video. I recommend everybody to download presentation. It is the link in the description. In the presentation you'll find links to the scientific publications. So it is I did this presentation and this research for myself because I have to understand better what should I do to make the rejuvenation of my body efficient and how to get the results for sure. Okay, so then my protocol of exercises is much different from what is recommended in literature for bodybuilders or other sportsmen, okay, and even for elders. Okay, here as the presentation is long, I give very short abstract of the video. So the mitochondrial dysfunction is an important part of the aging process. Yet exercises, proper diet and supplements may reverse aging. Professional bodybuilders don't live longer than common people. Meanwhile, my primary goal is a lifespan extension, therefore I don't follow recommendations for bodybuilders in my physical activity. For example, concurrent training by combining resistance exercise and endurance exercises is not recommended to practice during the same session for muscle growth. Carbohydrate intake totaling up to 550-625 grams per day is recommended for bodybuilders to grow muscles, etc. Other recommendations which I don't follow. So as we see in young adults and young people and adults, mitochondria are healthy. They in large amount, large number and volume, and then they produce a lot of energy. But in older age, what we have decline in in the volume of my mitochondria, and we have decline in mitophagy, so removing of the damaged the mitochondria, and also yeah, there is decline in muscle mass and strength, obviously. So again, in young people and adults, mitochondria work properly, and we are getting energy mostly, at least in muscles, we are getting mostly by oxidation of carbohydrates and glucose and amino acids and fatty acids. But as we are aging, what is happening that mitochondria gets damaged, and it is producing more reactive oxygen species, and these radicals, these reactive oxygen species, they damage proteins, they damage the membrane, and then it results in reduced cell function. Okay, of course, caloric restriction and exercise, it is already established that they slow down aging, and so in sense of mitochondrial biogenesis and production of new mitochondria. Okay, also as I said, concurrent training is not recommended for bodybuilders because it was established that the only resistance training gives better result in long term than combination of this endurance exercises and resistance exercises. So concurrent training is not efficient, so it is not recommended for bodybuilders. But again, I do it different. Okay, opposite to the recommendation for bodybuilders, I practice extended endurance exercises. Extended, it means it's long. It's I do rowing 80-90 minutes and treadmill low pushing 15-20 minutes, and only then I go to high intensity low volume resistance exercises for about 30 minutes with a short 1 minute rest intervals between the exercises. What I see in my gym, people do it, the exercises much different from what I am doing. But okay, I'm much older also, I'm 65. The purpose of the endurance exercises, or my endurance exercises, extended and endurance exercises, is to deplete storage of glycogen and to ignite autophagy. Depleting the glycogen storage will increase the level of lipolysis and mitochondrial activity. So of course it takes time. It is not in one session. I mean, but eventually I see progress in time, that how lipolysis is growing. And high intensity volume resistance exercises till failure. What is important to mind, that all exercises, both this extended endurance exercises and high intensity resistance exercises, they have to be done till failure. Till failure, it is real failure, that failure to continue the exercise, complete failure. Okay, not just fatigue. So this high intensity low volume resistance exercises still favor stimulates satellite cells and growth of muscle cells. Both these extended endurance exercises and high intensity low volume resistance exercises activate myogenesis, that is production of new mitochondria. And indeed, I experienced gradual improvements in endurance and muscle strength both. Okay, so the traditional view of resistance training is that it leads to muscle hypertrophy. And endurance training produces more mitochondria. So it is mitochondrial biogenesis. So more mitochondria will be produced according to endurance training. So as I said, goal of my research is rejuvenation of the human body and essential lifespan extension. It appears that there is neither a magic pill or no partial genetic reprogramming that may be a solution. However, with physical activity, supplements, and proper diet, and this what proper diet, I mean strict carnivore ketogenic diet. What it means? It means I don't consume carbohydrates at all, and the amount of fat which is used as a source of energy is 80% in all balance of energy. So of course, I don't use proteins as a source of energy. It is only for maintenance of the body, but in calculations you can estimate 20% of energy is from proteins, and 80% from fat. It is about this relation, not simple carnivore, but ketogenic carnivore diet. Okay, then with all this details, we are able to, in my opinion, to manipulate epigenetics of our bodies and provide expression of the longevity genes. Physical activity is an important and flexible tool, considering that we may vary intensity, volume, and frequency of physical exercises, as well as a way of breathing, breath holding, and even partial pressure of oxygen in the inhaled air. So here it is the carnivore diet, typical carnivore diet is presented, but as I said, I use much fat as a source of energy, and so I add much more coconut oil. This is saturated fat, very good for health, very good to produce ketones and to keep as a source of energy. And also I try to eat minced meat with fat in it. Okay, so this is important to have combination of fat and protein, and fat is the main source of energy. It is the only source of energy. Proteins are used for maintenance of the body, not as energy source. Hyperbaric oxygen therapy utilizes higher partial pressure of oxygen for breathing than in normal atmosphere. Repeated intermittent hyperbaric oxygen therapy so can induce physiological effects which normally occur during hypoxia. Hypoxia, it is not enough oxygen. So it is strange. It is so-called hyperoxic hypoxic paradox. So it's very strange indeed. On the cellular level, it was demonstrated that hyperbaric oxygen therapy can induce an expression of hypoxia-induced factor 1 alpha, and activation of the sirtuins and stem cells proliferation, and then mitochondrial biogenesis. Even senescent cells, even hyperbaric oxygen therapy may induce clearance of senescent cells in the aging population, according to the publication. You can click and to see the publication. The mechanism may be related to significant improvement in mitochondrial respiration and increased mitochondrial mass. Okay, this is a picture of this high pressure boxes for hyperoxic therapy, hyperbaric therapy. So people regular coming and getting exposed to high pressure air with a high concentration of oxygen in it. But also you can buy individual chamber and sleep in it with higher pressure of oxygen and higher content of oxygen in air. Okay, aging is accompanied by a reduction in the oxygen delivery to all organs and tissues, resulting in the development of hypoxia. Hypoxia is a condition in which the body or a tissue of the body is deprived of adequate oxygen supply, and hypoxia may be classified as affecting the whole body or local, affecting a part of the body or tissue. Hypoxia differs from hypoxemia. Hypoxemia is abnormally low level of oxygen in the arterial blood. Hypoxemia can cause hypoxia as the blood is not supplying enough oxygen to the tissues of the body. We may also distinguish acute, intermittent, and sustained or chronic types of hypoxia. Intermittent hypoxia therapy is able to double the lifespan of wild-type worms, but not in animals somehow. But yet there are some health benefits. Okay, so what we have, hypoxia can be a result of some elevated exposure to elevated places, but also in diving, especially free diving, is develops hypoxia, and but in aging also another also hypoxia develops, and we have all these cardiovascular and cerebrovascular diseases, atherosclerosis, etc., etc. So it is really big problem, and in aging we have chronic hypoxia. Intermittent hypoxia treatment was used on older patients for half of a year, and modest improvements in some measures of metabolic health was demonstrated. Chronic inflammation and fat mass were reduced, also in lesser size compared with the structured exercise program. So intermittent hypoxia exposure allows modulating and stabilizing so-called hypoxia-inducible factor 1 alpha, which is involved in the regulation of the inflammatory response and lipolysis. The intermittent hypoxia might be a useful therapeutic tool to deal with problems associated with aging, such as the increase in body fat, the loss of bone mass, and low-grade inflammation. So there is a publication on it. So, but the results are not so high. Meanwhile, sportsmen use this intermittent hypoxia to produce more erythrocytes and to increase hemoglobin in blood, and then it is working. It is endurance is improving if this exposures or to the hypoxia are done, and it's normally can be done both by reduced oxygen pressure in inhaled air, but also if at some high elevated places it can be training at highly at elevated places can be so beneficial for sportsmen. Okay, exercise-induced hypoxemia, it's again is well described in endurance training athletes during both maximal and submaximal exercise intensities. Okay, so we can so some marathon runners and other athletes can experience this hypoxemia, low oxygen amount in blood, arterial blood. However, This exercise-induced hypoxemia did not occur in any of the untrained subject or moderate trained subject, just because they cannot get the intensity which the experienced athletes can produce. Okay, hypoxic endurance exercises with lower oxygen partial pressure, so like about 15% instead of 21%, reduced speed of running during high intensity interval training, causes greater metabolic stress and elevation of the exercise induced blood lactate level. But again, adaptation to long-term, longer than 21-day in this intermittent hypoxia endurance exercises increases erythrocyte volume, maximal aerobic exercise capacity, and capillary density in muscle. So it is, again, for athletes, it can be beneficial. Okay, but again, I'm a diver, and so as far as I know, diving is very good for aging, to slow down aging. And currently, we have such examples. Currently, there are about 2,000 women divers AMA in Japan. They are in average 65 years old. Most AMA are elderly women, and some even surpassing 90 years of age. Yet they are going diving. And so they practice the art for many years, spending much of their life at sea. So some Japanese women began diving as AMA as early as 12 or 13 years old, and taught by elder AMA. Even in modern times, AMA dive without scuba gears to about 20 meters deep and holding breath from 2 to up to 7 minutes. Obviously, free diving is going in conditions of intermittent hypoxia. So despite the early start, these free divers are known to be active well into their 70s and even longer, as I said, up to 90 years of age. So they are rumored to live longer due to their diving practice. Okay, this is how they are diving. Some diving not so long, not so deep, like 20 meters, but there are some individuals, some women diving up to 40 meters. This is really something outstanding. Okay. Under normoxic conditions, mitochondrial respiration consumes greater than 90% of the oxygen in humans. And remaining oxygen in cells is about 10%, is utilized for degradation of hypoxia inducible factor. This is what I was talking about already. And this is a protein complex composed from two subunits, alpha and beta. And this hypoxia-inducible factor 1 alpha regulates vascular dilation, blood vessels proliferation, tissue inflammation and growth, as well as balance between glycolytic and oxidative metabolism of glucose to maintain cellular homeostasis. In conditions of chronic hypoxia, mitochondria consume and remove almost all free oxygen in cytoplasm, and causing the rapid stabilization of this protein complex. Okay. So, cancer cells, okay, sorry. So what we have skeletal muscles, if they are exposed to repeated acute hypoxia, so intermittent hypoxia, and plus exercises, what results, it is we can see increase in protein synthesis, growth hormone, satellite cell activation, and type 2 fiber recruitment. So the muscles are growing, the strength is improving. But chronic hypoxia works different. That what is happening, degradation of protein is higher than synthesis, and chronic inflammation develops, and what we see, a decrease in physical activity, not so good sleep, lost appetite, etc. So, and this chronic hypoxia is typical for diabetic, the people sick with diabetes. Okay, diabetes leads to chronic hypoxia in some tissues. Okay, cancer cells display high rates of aerobic glycolysis and a phenomenon known historically as the Warburg effect. Lactate and lactate and pyruvate, the end products of glycolysis, are highly produced by cancer cells even in the presence of oxygen and efflux of lactate from the cells. As a cancerous tumor develops and grows, an extreme hypoxic microenvironment is created surrounding the tumor. High rates of aerobic glycolysis can promote the malignant transformation and survival of the cancer cells. Chronic hypoxia plays important role in cancer initiation, progression, and metastasis. Chronic hypoxia is mainly observed in the tumor environment as the blood supply soon becomes inadequate for the rapidly growing number of the tumor cells. So that what have normal cells, they mostly produce energy by oxidative phosphorylation in mitochondria, and only very small amount by aerobic glycolysis in conditions of hypoxia. Okay, so intermittent hypoxia or anaerobic exercises. But meanwhile, tumor cells, they produce mostly 95% of this energy by conversion by so-called fermentation of glucose to pyruvic acid and then to lactate. Lactate is getting out of the tumor and make microenvironment around the cancer cells acidic. So what we have, this is a tumor, schematically represented, and near the blood vessels, concentration of oxygen is high enough, but yet cancer cells use this fermentation process to produce energy because they need carbon to grow and multiply. And in hypoxic conditions, they obviously use glucose and transform glucose to pyruvate and then eventually to lactate. And lactate is getting out, but if it is a tumor, then lactate can be used by other cancer cells, and it can be converted to pyruvate, and then it even can be used as a source of energy in mitochondria. But this is not so, not so typical. So, but again, cancer cells can use oxidative phosphorylation in mitochondria, but they just prefer mostly this way of fermentation. Most probably because of hypoxia, because the quickly growing tumor does not have enough of oxygen. So this is a Warburg effect. With age, energy metabolism in cells is shifting from oxidative phosphorylation in mitochondria to aerobic glycolysis in cytoplasm. Okay, this is what was I talking. This reduces the efficiency and total energy generation in the form of ATP molecules in many tissues such as liver, skeletal muscles, and brain. As a result, energy-dependent physical activity and other cellular functions decrease due to unmatched energy demand and supply. In return, decrease in the physical activity in older age accelerates this metabolic shift, forming a vicious cycle. Unlike glucose, fats can only be oxidized to produce ATP. Aging can be retarded by caloric restriction and physical activity, but again, if we pay attention about the use of fat as a source of energy, it's also a tool to decelerate aging. So you can read this publication. The dynamic balance between protein synthesis and degradation processes is a key factor behind maintenance of muscle mass. Protein synthesis is an anabolic process requiring an amount of energy which is insufficient in hypoxic conditions. And chronic hypoxia is negatively affects skeletal muscle protein synthesis. And there is a tight correlation between aging and chronic hypoxia with decrease in muscle total mitochondrial volume. Okay, therefore hypoxia and aging seems to share some common pathways. Okay, you can read publications. It is old publications, and it is the link is a little bit different to old publication. Aged organisms demand more glucose as energy source. Therefore, gluconeogenesis is elevated in aged mammals, while hepatic conversion of glucose to glycogen is decreased. Again, we have to pay attention that it is true for people who stay on standard diet and they use glucose as a main source of energy. Okay, then again we see that young age people are very physically active and skeletal muscles are of normal mass and normal function, and we have a higher number of mitochondria, higher volume and adequate functioning and activity of mitochondria. But as in older age, what is develops, it is developed chronic hypoxia, and what is happening, sarcopenia, so decreased mass of muscles, just because they don't have enough energy to grow to synthesize the proteins, and also functional impairment of the fibers, and mitochondria are aging. They are smaller in number. They because of reactive oxygen species, they have damage of DNA, mitochondrial DNA, and increased apoptosis of the muscular cells, and that not enough autophagy, so the mitochondria, that damaged mitochondria are not removed during autophagy, and impaired biogenesis, so not enough mitochondria are produced by cells. This is aging. This is why the elders are losing energy. Emergent evidence suggests that reduced muscle oxidative capacity and chronic hypoxia underline the mobility loss in older adults. Older adults who maintain a high amount of physical activity have better mitochondrial capacity, similar to highly active younger adults, and this is related to their better muscle quality, exercise efficiency, and physical performance. So you can read. So again, if you are a little bit crazy about physical activity, even in older age, your energy is compatible with younger adults. Development of sarcopenia, the loss of muscle mass, and physical performance with age is related to mitochondrial dysfunction. Exercise is currently the only effective option to treat sarcopenia, and does so in part by improving mitochondrial energetics and protein turnover. So if mitochondria produce more energy, then it is enough for synthesizing of protein. Aging is characterized by a general decrease in oxygen supply to tissues. So again, this is chronic hypoxia. And diminished vascularization in aging alters the diffusion of oxygen at the capillary tissue level, and at advanced stage, this can lead to tissue hypoxia. Exercise training induced sirtuin-1 activity and induced sirtuin activity and normalized the age-associated shift in the redox balance, expression of hypoxia-inducible factor 1 alpha, and vascular and cellular growth factor. Okay, so again, exercises make this metabolism to normal. In humans, modest alcohol consumption promotes health despite it causes oxidative stress, as it can have hormetic effects similar to moderate exercise via resistant reactive oxygen species generation. This is some, I don't know, it needs to be confirmed by independent research, but yeah, probably there is some logic in it, so that alcohol in small amount produce reactive oxygen species and in cells, and it gives some stress, and hormetic response to the stress would be maybe similar to physical exercises. Physical exercises, they produce erectile oxygen species, obviously. Let's talk about physical exercises. We may classify physical exercises to two major groups: resistant exercises, endurance exercises. Endurance exercises is aerobic activity when our body produces most of its energy by burning glucose, fatty acids, and amino acids in mitochondria. Resistant exercises or strength training is mostly anaerobic activity, but it's not necessary. It can be aerobic, can be anaerobic. It depends on the protocol. During resistant exercises of high intensity, as well as during high intensity interval training, this is something new. High intensity interval training, athletes experience the intermittent hypoxia in muscles as local oxygen demands exceeds its supply. Acute intermittent hypoxia during anaerobic resistant exercises may not remove a sufficient amount of cytosolic free oxygen to allow stabilization of this hypoxia-induced factor 1 alpha. Instead, this intermittent hypoxia activates production of inflammatory mediator, but also it is a part of that muscle growth. So we have strength training versus endurance training. This we see that it is different. And of course, muscle bulking is, for muscle bulking, we need strength training and stress to the muscles. Low volume, high intensity interval training, this is something again new, which is recommended, typically involves in total 15 minutes of the exercise per session. And the findings from recent trials suggest that this way of low volume, high intensity interval training can induce similar, at times even greater, improvements in cardiorespiratory fitness, glucose control, blood pressure, and cardiac function when compared to the more traditional forms of moderate intensity endurance exercises and high volume, high intensity interval training. So again, this publication claims that a low volume, high intensity interval training, which is 15 minutes instead of 1 hour, it is actually saving time and produces even maybe better results than high volume, high intensity interval training. So the sessions which are lasting typically 30 minutes and 1 hour. Okay, despite they require less time commitment. Okay, you can check it as a publication. And this low volume, high intensity interval training isn't limited to running. It may also incorporate other type of endurance exercises like swimming, rowing, cycling. Alternatively, the principles of high intensity interval training can be applied to high intensity, low volume, low intensity, low volume resistant exercises with progressive overloading until failure. Okay, so again, this is a short boosting, low volume, high intensity training. It is short. It is saving time. It is burning fat quite well, but actually it is not producing muscle mass. Meanwhile, low volume, high intensity workout results in muscle mass production, but again, it depends. You can do this rowing, for example, both is endurance exercises and other is resistance exercises. Okay, this or that. But also you can combine and you can modify this workout with intervals of very high intensity and then less intensity, etc. So it can be modified. Probably it is very flexible way to work with this rowing machine. Also, in low volume, high intensity interval training, the bursts of maximum intensity followed by brief low intensity intervals at 50% of the maximum intensity, and they have to be repeated until exhaustion, so failure to continue. This again, this is important to do it until failure to continue. This is absolutely important in my methods, and this recommended also. So only question that it takes me longer to get to the failure, to the exhaustion. Okay, normally low intensity periods have to be twice shorter than maximum intensity ones. Okay, it's really intensive. Okay, then high and moderate volume and endurance exercises session are effective at burning fat, but without resistant exercises, an athlete may also lose some muscle mass. This is what I was talking, that even with high intensity until failure or this high intensity interval training, muscles grow not so well. In contrast, when low volume high intensity interval training is combined with resistance exercises that include repeating intervals of 20 seconds at the maximum efforts followed by 40 seconds of rest, it was more efficient in caloric expenditure during exercises compared to normal resistance exercises or endurance exercises. Okay, this is also combination of this and that, and again, exercises very flexible too. Anybody can adjust these sessions so that for maximal performance, for maximal efficiency. So also burning of fat is going through higher post-workout metabolism. Okay, you can read publication. It is well known since 80s that concurrent training, strength in resistance exercises and endurance in endurance exercises is not recommended to practice during the same session for muscle growth. Again, this is a recommendation for bodybuilders. So general recommendations for bodybuilders are as follows. Resistance exercises should be done first if both training modes are performed in the same session. Perform endurance exercise in the morning and resistance exercise in the evening if you train twice a day. Separate training modes with over 8 hours of recovery, and if possible train different body parts in endurance exercises, resistance exercises sessions of the same day. You can read about concurrent training more in this publication, but again, so it is what is said, that skeletal muscle hypertrophy gets better if rules are separating, like exercise both by 6 or one day, and adopting strategies that minimize overall exercise volume. So to using high intensity training and 2-3 days of aerobic exercise and maybe 2 days of leg lifting, etc. And again, it is quite different from what I'm doing. According to a traditional consensus, metabolic stress of endurance exercises is required to drive mitochondrial adaptation and simulate mitochondrial biogenesis, so production of new mitochondria is what I was talking about. And meanwhile, resistant exercises is required to drive myofibrillar adaptation, which upon prolonged training can accumulate into muscle hypertrophy. Recently, reports indicated that traditional high-intensity, low-volume resistance exercises, or so till failure, again, what is important, till failure can also stimulate muscle mitochondrial biogenesis and mitochondrial respiratory function, similar to prolonged extended low load. I mean, low load is relatively low load. That's like below 40% from maximum load. Resistant exercises till failure. But again, if you, what is important, till failure, low volume, high intensity, or till failure, high volume, low intensity, this or that. Failure that's working till failure, till real failure is that the athlete cannot continue exercise. Cannot, because it is completely exhausted, completely. Yeah, it's already failure, complete failure. Okay, not just some discomfort. No, it is complete failure to continue exercise, repetition of the exercises. So not only extended interval training, but also high intensity, low volume resistance exercises, but also low intensity, high volume resistance exercises. Again, repeated until failure produce greater ATP turnover compared to traditional resistance exercises. This again, failure is important till failure, and progressive overload, because endurance and strength are growing, so it is important to go to the progressive overload and increase the stress, increase the load and the intensity of the exercises. So there is an agreement that exercise is a powerful stimulus to increase both mitochondrial function and content. Okay, just exercising in average. Training intensity may be an important determinant of the improvement in mitochondrial function as determined by mitochondrial aspiration, but not mitochondrial content, so it's volume of the mitochondria. And in contrast, it appears that training volume rather than training intensity may be an important determinant of exercise-induced improvement in mitochondrial content. This is something strange. I mean, yeah, a little bit strange, because it is again, even it has been told that even in any exercise, if the goal is to improve mitochondrial function, it is important to increase volume, not only work till failure, but also to increase volume of the exercises. Exercise-induced mitochondrial adaptations are quickly reversed during the reduction or cessation of physical activity. So in 2 weeks it just will go down. So this, you can read publication, and again what we see, endurance exercises and resistance exercises in untrained and trained, they're working almost the same. So what we have, endurance exercises is increasing number of mitochondria and density of the ribosome to produce the proteins, but not so much, mostly number of mitochondria grows. And in resistant exercises we have mitochondrial biogenesis is go up, but not very much, and but much more ribosomes to produce proteins, to synthesize protein appear, and then new proteins, new muscle cells generated, and muscle volume is increasing. So it is different endurance and resistant exercise. But what was demonstrated, and that very intense like sport intensive training, sport intensive training. So it is condition like similar to low volume, high intensity interval training. They produce the highest improvement in the respiration of mitochondria. So, and especially in comparison with medium intensity the training, and then so it's again recommended to use very high intensity boosts in, and that's bouts and some 50% of the load between for rest, and but again short, it has to be very intense. And here again we see that that making twice a day is better, exercises twice a day better than once a day, but okay, it's whatever. It's, we probably cannot afford so much training. And again, what we have, if we have we use oxygen to for oxidative phosphorylation to produce energy, and that's in exercises. What is happening in exercises, the mitochondria, we have fission of mitochondria, they are splitting to smaller pieces, and smaller mitochondria work better. And what is happening again, that here it is demonstrated that mitochondria grow and splitting, and they produce more mitochondria. Eventually it is improving the efficiency of mitochondria, over how mitochondria work. Okay, therefore, opposite to recommendation for bodybuilders. So it relates to my research, and so I decided not to follow recommendations for bodybuilders, but I practice an extended endurance exercises, which is, as I was talking already in the beginning of the video, at 90 minutes of rowing and 15-20 minutes of treadmill wall pushing, and then high intensity low volume resistance exercises for about 30 minutes with short rest intervals, shorter than 1 minute, between the resistance exercises. Different. I go from one machine to another, or take dumbbells and something like, and so try to not to rest too long. The purpose of the endurance exercises is to deplete glycogen storage and to ignite autophagy. So this what I take care about. So I really see how glycogen storage can be depleted, and then autophagy is can be ignited. Depleting the glycogen storage will increase the level of lipolysis and mitochondrial activity. Meanwhile, high-intensity, low-volume resistant exercises still favor, again important, still favor stimulates satellite cells, growth of muscle cells. And both endurance exercises and high-intensity, low-volume resistant exercises still favor, again, please mind that still favor is important, improve myogenesis and mitochondrial activity. So this again, if conditions of working till failure, till that impossible to continue the exercise is achieved, then myogenesis and mitochondrial activity grows both in endurance exercises and high intensity as the resistance exercises. And indeed, I experience gradual improvements in endurance and muscle strength. So this is some just, it's not me, of course, sorry. So, but I do this rowing machine and treadmill wall pushing just to show you what is the technique of it. This what, again, everybody different. I like a rowing machine and treadmill, also not bad, but mostly I spend time in rowing machine because more muscles are working. It is not only back, it is legs and hands, and so it is really very convenient machine for. So again, comparison with high intensity low volume and low intensity high volume. This is, you can compare that. It is quite well known that Schwarzenegger was using low intensity high volume exercises. He was spending in a gym hours and hours, and coming morning and then afternoon. So it's again, you can get that high volume bulking of muscles with this method, or otherwise you can use high intensity low volume and get into the gym maybe 2-3 times a week and spending not so long in the gym. It even work, to my opinion, better. In general, the liver can store up to 100 gram of glycogen, and there is about 350 gram in skeletal muscles. So it's about 1,600 calories in total. And glycogen storage can be depleted after approximately 80 minutes of high-intensity endurance exercises at a maximal lactate steady level. Again, it's not easy to deplete the glycogen storage, not easy. And this will cause fatigue to develop quickly after depletion of the stored glycogen, eventually to a failure to continue the training. This is what I'm doing. It's not only coming to fatigue, it's a little bit more than to failure to continue the training and even endurance exercises. Carbohydrate intake totaling up to 550-625 grams per day restores muscle glycogen stores to pre-exercise levels within the 22 hours between exercises. Therefore, carbohydrates are recommended for bodybuilders. Instead, I follow a strict carnivore ketogenic lifestyle with no or very low carbohydrates. So it is what is recommended for muscle building. It is the carbohydrates. Carbohydrates produce insulin. They result in consumption of carbohydrates results in increased insulin level in blood, and insulin is important for muscle building. Even some bodybuilders make injections of insulin, and this is to my opinion, very unhealthy. Very unhealthy. This is why the bodybuilders live not so long mostly. Okay, intermittent fasting is such a daily time restricted feeding is not as effective as calorie restriction in extending maximum lifespan in mice, but it has many of the same effects on the health as calorie restriction. Intermittent fasting is also extends life to some degree in a variety of organisms, including bacteria, yeast, nematode, worms, and mice, even when overall intake of calories is not restricted. Intermittent fasting has been shown to reduce the risk of developing a variety of age-related pathologies in cardiometabolic diseases such as type 2 diabetes. Intermittent fasting helps to change microbiome population and reduce chronic inflammation and autoimmune disorders. You can read publication. An official opinion that dominates in literature is that high animal protein diets accelerates aging and can increase the risk of aging-related diseases. Okay, this opinion is based on the fact, that consumption of too much animal protein activates the growth hormone, insulin, mTOR, and this mTOR it is mammalian target of rapamycin. So it is it ignites growth of proteins. I mean synthesis of proteins. Okay, also testosterone and insulin-like growth factors that are responsible for muscle growth in old age. Okay, so indeed, caloric restriction, calories restriction, and rapamycin and suppression of the growth hormone increases lifespan in organism ranging from budding yeast through mammals. So this again, if you use rapamycin, you will live longer, but you develop the sarcopenia and the muscles will decay. So it is not recommended, even with rapamycin, it is not recommended to take it a long time, only 1 month, and then big interval for rest, for recovery of the body. But again, I don't see anything good, both in calorie restriction and rapamycin. So it's again, but dominating opinion again that if we have to extend our lifespan, we have to follow plant-based diet with plant-based proteins, and also we have to reduce calories and use, and the rapamycin is like the best supplement which increase the lifespan. I don't think so. Okay, again, this is a dominating opinion, so I cannot add anything else because it is just, my opinion is just different. However, diet based on carbohydrates also accelerate aging by stimulating the insulin secretion and stimulation of this insulin-like growth factor 1. Carbohydrates are not healthy at all. So while too much of animal proteins indeed accelerate growth of the cells and synthesis of proteins, it also suppresses autophagy and may shorten lifespan, the right way is to follow carnivore ketogenic diet and intermittent fasting. Okay, so if we follow this idea, then it will be different, completely different from what is visual opinion. Okay, that is to get energy from animal fat and other saturated fats, while proteins are necessary for maintenance of our body. Eating fats does not increase glucose and insulin level of the blood. So it is all disadvantages of to follow very much protein, both protein based on plants and protein based on animal sources. It is so it is different. It is much more beneficial. Okay, then eating fats don't ignite this mTOR. They don't ignite growth hormone and testosterone. Pardon, testosterone, not here. I made a mistake. Testosterone. And fats burn slowly. Therefore, intermittent fasting is a very natural way of the lifestyle on the ketogenic diet. With intermittent fasting, proteins are consumed once a day, for example, after a workout session. And if you have stimulus for muscle to grow, then you eat protein and you use these proteins to grow muscles. But if it is a resting day, you can reduce the amount of proteins once a day. Okay, so it is, again, depends on the physical activity. So most of the day mTOR is suppressed. This and training in the fasted state and keep the ketosis ignites autophagy. Autophagy is absolutely important for lifespan extension. It is important to understand that it takes no shorter than 3 months to change from glucose to fatty acids and ketones as a source of energy for our body. Personally, it took me longer than 6 months. While I lost a lot of muscle mass, despite of everyday cycling for about 40 kilometers, swimming for hours at weekends, and regular workouts in a gym. Every day I was trying my best, but again, what I lost muscles, I got a lot of troubles. So, as I didn't know about importance of electrolytes, magnesium and potassium, I suffered regular muscle cramps with severe pain at night. Yes, it is possible to accelerate a transition to deep ketosis with MCT and coconut oils, but I didn't know about this trick. Again, I share my experience in my videos. Hope it will help somebody. But again, it is not easy as you may think, that to shift from carbohydrates to fat as a source of energy. Absolutely not easy, but it is so much beneficial for health. So therefore, during this transition, glucose was produced by glyconeogenesis from proteins in my muscles. So I lost muscles because my body was using glucose as a source of energy for long. So this was quite painful experience, I would say. But again, I didn't know what to do. I didn't because there are some tricks to shorten this transition time and to not to lose muscle mass. And again, what is the problem with the official opinion that most of clinical trials to compare standard ketogenic and carnivore diets are done with duration of a few weeks or shorter. Of course, despite high level of ketones production in the liver, glucose will be yet used as a source of energy